A lot of what happens that affects people's health is sort of how your life is going relative to your expectations. And a part of the US society, which is much less homogeneous, is that expectations are. So, as I said, the relationship between income and longevity is very well known. Since the 1970s, it's been very clear that people with higher income live longer than people with lower income. That's certainly true. In fact, if you take more or less any measure of socioeconomic status you can think of, people in higher socioeconomic status live longer than people in lower socioeconomic status. They're also healthier while they're alive. So now what you're looking at here is one of the key charts. On the horizontal axis here is the income percentile. So this is ranked from 1 to 100, all the people who are in that income percentile. We have their incomes here. These are the percentiles, and then this is showing you the annual incomes. And then this is the expected age at death. The first thing you can see is that this line is very upward sloping, so that people who are lower income have a shorter life expectancy than people who are higher income. There is no income at which having more income is not associated with living longer. How big is this gap? So it turns out that the bottom 1 percentile has a life expectancy of about 72.5 years. And the top 1 percentile has a life expectancy of about 87 years. The gap between those is about 15 years. If you were to look at the US men compared to the average in other countries, the highest income men would rank the highest life expectancy in the world. Remember, this is not relative to high income people in other countries, it's relative to everyone in other countries. The median in the US would be pretty high up, and then particularly as you get far down, the US does very poorly. That was for men. If I show you women, this is the chart showing you both men and women. This is the same chart for men. Women are in red above them. At all incomes, women live longer than men. The gap for men, as we were talking about, is about 15 years. Get rid of a few of those years at the very end. The gap for women is about 10 years. Get rid of a few of those years at the very end. So I've seen this chart for Norway. As I said, I'm doing it for a bunch of other countries as well. The biggest difference between the US and, say, Norway is that the Norwegian line would come out like this and then drop down some. What this is doing here is it's plotting the change in life expectancy for different quintiles of the distribution. So this is for men at age 40 who are in the bottom quarter of the income distribution, what's happened to their life expectancy. This is for men who are in the top quarter of the income distribution, what's happened to their life expectancy. Obviously, there are big differences at a point in time. That's what I was showing you. The higher income men live longer. Unfortunately, the gap has been getting bigger. That is particularly true for women, where the highest income women are rising in life expectancy quite a lot. That's true also of the second highest. And then it goes down from there. The lowest income women are still increasing in life expectancy, but nowhere near as much, only about a half to a third as much as the higher income women are. We then said, what is it that is, how can we understand this? Like, why is this? What can we say about why this is? What we did is for each area of the country, we calculated what life expectancy is at age 40. And we did this actually by income percentile. So this is the bottom quartile of the US income distribution. The darker colors are areas where people live less long, and the lighter colors are areas where people live longer. And you can actually see there's enormous variation here. Some of the things that we looked at, so first off, these mortality rates, these longevities are related to health behaviors. So in areas where people live longer, smoking is lower, obesity is lower, exercise rates are higher. That just shows you that there's something about the behavioral component to this. The real question is sort of why are people smoking more? Why are low-income people smoking more in these areas than they are in these areas? And that's a question I want to come back to. It's not particularly associated with healthcare, nor is it particularly related to a lot of social factors. It's not so related to how segregated people are in terms of where they live. It's not particularly associated with unemployment rates. It's not associated with population and so on. What it is associated with is what I think of as kind of upper middle class areas. So areas where house prices are high, where local governments spend a lot, where there are a lot of college grads, where there are a lot of immigrants, where the population is very dense, sort of urban areas like that. Those are actually areas where even low-income people live longer. We sort of talk sometimes about two Americas, rich and poor. I actually think that's not quite right. I think there's really what there is there's a coming apart at all levels. This has lots of implications for things like what kind of policy, because the policy that makes sense for high-income people is not necessarily the policy that makes sense for low-income people, and indeed the policy that makes sense for low-income people in Boston may not be the policy that makes sense for low-income people in Birmingham, Alabama.